So hi, Kate and Michelle. Let's talk about the things that have arisen from this conference over the weekend.
Well, we're at the ASA Sonographers Conference in Melbourne, and the theme has been Educate, Elevate and Celebrate. And there's been lots of education of sonographers, lots of elevating of the sonographer knowledge and talk of the sonography profession and where we sit relative to other health professions, and celebrating the great things we do. You might want to talk.
And this year there's been a big focus on what they call the professional stream. So not just focusing on the clinical skills and knowledge that are needed for our profession, but the skills that often are undervalued and make a big difference to our patients in terms of person-centered care and communication. So I think the fact that we've had a lot of speakers talking about reflective practice, about clinical supervision, so the well-being of students in their training, the well-being of our patients, ensuring that they have safe and care, particularly for members of the LGBTQ plus community. So that's something I'm quite passionate about, and we need to improve our cultural competency and ensure that sonographers are lifting our standards across all our skill sets.
And we're navigating different territory where ultrasound's being used in all different aspects of healthcare. So there's many different professions using ultrasound. Sonographers are the experts in ultrasound, but we have to sort of navigate the territory where there's no actual regulation of who uses ultrasound and what sort of levels of qualifications or accreditation or registration they need. And so this is becoming a bit of a topical point.
And that's really important for patients to be aware that the person who picks up that probe, there are very different levels of skill and experience, and that we have a range of ultrasound operators, and as Michelle said, we are the experts in ultrasound, and other professions absolutely need to use that tool. But it's ensuring that everyone's working within the scope of practice, that we have regulation for our patient safety, which is of primary concern.